One of the modules on the Masters will be neuroethics. Neuroethics has been described as the ethics of neuroscience and the neuroscience of ethics. So trying to understand how human beings make moral decisions, but also looking at the ethical and social implications of neurointervention technology, for example. One example would be the use of brain stimulation techniques to treat psychiatric conditions. This would involve perhaps implanting electrodes deep into the brain, into an area that is associated with the pathology. And this raises important philosophical and ethical questions around the permissible ways that we can modify brain activity, the side effects that some of these techniques might have, implications for the patient's personality, and other side effects that might arise from changing the activity in the brain. There are various ways in which ethics and philosophy might have implications for policy, for example. So one of the questions that has arisen recently is how brain stimulation devices that are sold to consumers should be regulated. So these devices are non-invasive, they sit on the scalp and stimulate the brain by passing an electrical current through the brain. These devices are sold, for example, to enhance focus for gaming or perhaps athletic prowess. And policymakers have a challenge in regulating these devices because they're not falling under the traditional categories of medical devices, yet obviously are of concern since they're changing activity in the brain. And so policymakers are trying to understand how permissive they should be, how much risk they should allow consumers to choose to take in buying these devices. A particular philosophical question arises when we think about how we understand the nature and size of the benefits that a consumer enhancement device might give a user of that device. So when we're thinking about medical devices, we can usually understand that reducing pain, for example, will be a significant benefit. And so if we're weighing the risks of these devices against the benefits, we have a sense of how big that benefit will be. When it comes to consumer brain stimulation devices for enhancement purposes, how beneficial increased capacity for gaming is much less clear. And so how we understand the nature of these benefits and their magnitude will depend on questions of value, and how we weigh these against risks is a lot less clear. And policymakers are interested in exploring these conceptual questions because it can help inform the policies that they implement in regulation for consumer enhancement devices.